Come to the next question, that is 25th, that is identified 4, 6, 8, 2 respectively, right? Actually this is the diagrammatic presentation of the menstrual cycle of and which is given in NCERT page number 50. Right? That one shows the menses, clear? That 2 represents the progesterone, right? That right, that 3 shows the estrogen level, right? That 4th one shows the ovulation, that is the process, clear? That 6, these are called the developing follicles. That 6th one is called the mature follicle. Sixth one is called the mature follicle, right? That 9th is the developing corpus luteum. Developing corpus luteum, right? And that 8th one is the regressing corpus luteum, that is the corpus luteum gets degenerate here, right? Now these are the hormonal level, that shows that 7th shows the FSH level and that 5th one shows the LH level, right? That is luteinizing hormone. That 10th is the menstruation. Menstruation, right? That 11th is the luteal phase, which is also known as the secretory phase, right? 12th one is the proliferative phase, or we can say the follicular phase. Clear? So all these are the enumerations. Right now 4, 6, 8, 2. 4 is the ovulation, that is given in that 3, right? Come to the 4, 6. 6 is the mature follicle given in all threes. Then 8 is the regressing corpus luteum, right? So the D is also cancelled, it is given in both. And now what? 2, that is progesterone, that is the answer is A. Clear? So what will happen here? See now, this is actually this is the menstrual cycle. Menstrual cycle divided into 3 phases, that is menstrual phase, which comes from which is from 3 to 5 days duration of the menstrual cycle, right? And that 3 to 5 days, that is 1 to 5, that is menstrual phase. This is called the proliferative phase, and this is called the luteal phase or the secretory phase, right? And from that day the next cycle begins, right? So what will happen here? See that when all the hormonal levels fall down due to the fall down of the estrogen, progesterone, FSH, LH, right? the endometrium gets degenerate and the bleeding start, right? The number of there is some blood vessels are also ruptured, right? So per cycle 45 to 100 ml of blood is lost per month, right? Now what will happen, from that third day, right, recovery phase start. That's why after third day the flow gets gradually slow, right? And what will happen after the fifth day? From that, after the fifth day, the proliferation start, which is a 10 to 12 days cycle, and luteal phase is the longest phase of the menstrual cycle, that is 12 to 14 days, right? Gradually increases, right? Proliferation occurs, uterine endometrium gland and the blood vessels and the epithelium regenerate, right? The slowly here estrogen level gets gradually increased. So you can see here the estrogen level gradually increase, but at the level of when the ovulation occur at the 14th day, here ovulation occur, the LH level is at peak, right? FSH level is now fall down because there is no necessity of that. Clear? Then what will happen? After that, the follicles get matured and all these things, right? And after that, what will happen? If the fertilization occur and corpus luteum maintained, then the pregnancy corpus luteum, and if not occurs, so just 2 days prior of the menstrual cycle, you can see here, right? 2 to 3 days prior of the menstrual cycle, what will happen? The level of LH and estrogen progesterone gets reduced and the menstrual cycle appear. In that phase, luteal phase, progesterone secreting corpus luteum is formed, right? Progesterone secreting corpus luteum is formed, right? So that's why that luteal phase is also known as the secretory phase. This is all about the menstrual cycle, right? Now come to the next question. Come to the 26, that is identify the site which participate in the fertilization. That means it is talking about the ampulla, implantation, that is uterine cavity, childbirth, that is the birth canal, right? That is the birth canal, that is the vaginal and the cervix, and menstrual cycle respectively, that is the uterine endometrium, right? So this is the diagram of NCERT which is given in page number 45, right? That is the sectional view of the female reproductive system, that is the uterus, right? That first shows the uterine fundus, or we can say the fundus. That shows the uterine cavity, 10 uterine cavity, right? That too shows the isthmus, right? That 3 is the ampulla, that 4th one is the infundibulum, right? That 6th one is the fallopian tube, right? This 5th is the fimbres, 14th is the ovary, that 7th is the cervix, the 8th is the cervical canal, the 9th one is the vagina, 13th, that is the 13th is the perimetrium, 12th, that is myometrium, thickest layer of the uterus, and that 11th is the endometrium. Right? So this is all about this structure. Now sorry, come to the site of the fertilization. That is, site of the fertilization is the ampulla, right? But 3 is not given in that, so we can mark the 6, right? So 6 is given in first in both these options, so that is cancelled, right? Now what is that? Site of fertilization is ampulla, right? Then implantation occur in the uterine cavity or the fundus. So the most favorable site is the fundus, right? So it's okay. Then the childbirth, that is, childbirth is related with the contraction of the myometrium, and menstrual cycle is the 11th, so the answer is Bombay, right? Childbirth is how it is related with the myometrium, just because of the contraction in the myometrium, right? Labor pain starts, na? Clear? That's why. In seminal vesicle, prostate gland and the bulbourethral gland, which is also known as the Cowper's gland, how many of them are the paired, right? So seminal vesicle is paired or unpaired? It is paired, right? Bulbourethral gland is paired, but prostate gland is paired or unpaired? That is the unpaired, right? So the answer is 1 and 3 is paired, so the answer is Bombay, right? Come to the next one. Seminal plasma, that is the talking about the secretion of the seminal vesicle, is it is rich in the fructose, and the fructose is rich in, so these are cancel, fructose and sodium, and fructose and calcium, so this is rich in the fructose and the calcium, so answer is C, right? And we know that seminal vesicle, see here, seminal vesicle secretes the seminal plasma, and it forms 60 to 70% part of the semen, right? It forms the 60 to 70% part of the semen. Fructose is present in the secretion of the seminal vesicle. Prostaglandin is present in the secretion of the seminal vesicle, right, with calcium, iron, and all these things. So listen carefully, that fructose is the diagnostic test of the it is the diagnosis in case of the rape case, right? That fructose is produced by the seminal vesicle only. That is the only gland which can produce the fructose, right? So when the presence of fructose with the injuries are there, so that is the evidence of the rape case. Clear? So that is all about the seminal vesicle. Now come to the secretions of dash helps in dash. Secretions of prostate gland providing acidic conditions to the semen? No, right? It reduces the acidity, right? It reduces the acidity of the even female vaginal tract, right? So that is wrong. Clear? Bulbovestibular gland and alkalinity to semen, bulbovestibular gland is not there. Seminal vesicle and lubrication of penis? No, it is not. Bulbourethral gland, which helps in the lubrication of penis? Yes, so the answer is the D, right? To correlate all these things, you have to know about all the structures of the male reproductive structure. That bulbourethral gland is the Cowper's gland, which secretes the mucus, right? It secretes the mucus, and it helps to making the lubrication for the lubrication of the penis, right? And even it also neutralize little bit acidity of the male urethra just before the ejaculation of the semen, right? Stroma of ovary is divided into, we already studied that the stroma of the ovary is divided into the two parts, right? The inner one is the medulla, right? The inner one is the inner one is the medulla. So through medullary region the blood vessels enter and exit that, and that particular portion where the ovarian follicles are formed, that is called the cortex, right? That is called the cortex, and this is called the medulla. So outer cortex and inner medulla, right? Outer cortex, inner medulla, inner matrix, outer cortex. It is not it is medulla, not matrix, right? That's why it is wrong. Inner medulla, outer cortex, correct. Inner medulla, outer matrix, wrong. So answer is C, right? Come to the question. Birth canal is formed by, birth canal is formed by the cervical canal, that is the cervix canal, vagina, both A and B, and none. Right, so answer is both A and B, both get formed the birth canal, right? Match the column endometrium, perimetrium, myometrium, that is all these three layers are the inlining of the uterus, uterus that is hystera, hystera that is womb, right? Which is the female reproductive structure. Uterus is also known as the medical terminology for the uterus is known as the hystera, and the womb, right? Hystera or womb. These are the three layers. Outermost is the perimetrium, right? Myometrium is the middle one and the thickest layer, and the endometrium is the innermost layer, right? Thinner and innermost layer. Now what will happen? Endometrium is thin membranous, thick membranous, glandular, smooth and skeletal. So it is the glandular. Endometrium is glandular. Perimetrium, that is thin membranous. Myometrium, smooth muscle as well, thick, right? It is a smooth muscle, na? It's not membranous, it is a smooth muscle. So the answer is 1C, 2A, 3D. Answer is D. Clear? It's not related with the thick membranous and the skeletal muscles, right? Both these are the irrelevant options. Clear? So the correct answer is D. How many of these constitutes the female accessory duct, that is in the oviduct, the uterus and the vagina, right? So all these three are the accessory, female accessory structures actually, right? So the answer is third, that is female accessory duct. Clear? Now come to the next question. The spermatozoa, secondary spermatocyte, spermatid, primary spermatocyte and spermatogonia, how many are haploids? As we know that the spermatozoa are the haploid, secondary spermatocyte haploid, spermatids haploid, primary spermatocyte diploid, spermatogonia is diploid. So answer is 3, that is C. Clear? Now come to the next, that is oogenesis is initiated at puberty. No, we know that it is started at the time of embryogenesis, right? So during embryonic life, not at birth, not after 1 year of birth. So the answer is Bombay, right? How many primary follicles are left in ovary at puberty? That is 60,000 to 80,000. Actually, at the time of embryogenesis, approximately 2 millions of ovarian follicles are formed, right? And at the time of puberty, right, each ovary carry approximately 60,000 to 80,000 ovarian follicles, right? So the answer is 60,000 to 80,000. And even in that follicles, only mature 440 to 450 to 550 ovarian follicles get matured in whole reproductive life of female, right? So we have sufficient amount of ovarian follicles, primary follicles, that is 60,000 to 80,000 primary follicles are there, right? Now come to the next. Each testis has how many seminiferous tubules? Each testis has how many? That is, its number is 600 to 800, that is approximately 500 to in each testis, right? At that seminiferous tubule is when we see the cut section of the testes, right? So in each testicular lobules, 1 to 3 seminiferous tubules are present over there, right? So that's why when we calculate it, so the number of seminiferous tubules is 500 to 750 around, and its range is 600 to 800 actually, right? So the most appropriate answer according to that is 37th. Now come to the match the column, that is the part of the sperm, right? Head is related with the acrosome and the nucleus. Clear? Neck is related with the centriole. Middle piece, that is the, and tail is axial filament with sheath. So the answer is 1D, 2C, 3B, 4A, that is Bombay. Clear? Answer is Bombay. Choose the wrong statement. In one ejaculation, 20 to 30 crore sperms are released. It is correct, right? That is per ejaculation, if we will count, that is 200 to 300 million sperms per ejaculation. And when you convert it into crores, then the 200 to 300 million is approximately 20 to 30 crores, right? Sperm fertilizing is acidic in protein. Sperm carry the anti-fertilizing, not the fertilizing, right? So that statement is wrong. Fertilizing is carried by the ovum. So that statement is correct. Cowper's gland is also known as the bulbourethral gland, exactly because they are situated besides the urethra, and they are small bulb-like structures, right? That's why they are called the bulbourethral gland. So the answer is B, because the wrong statement is Bombay. Answer is Bombay. Clear? Now come to the next question. Labia majora, Skene's gland, Bartholin's gland, Graafian follicle, all these are related with the female reproductive structure. Labia majora belongs to the external genitalia of the females. Skene's gland is called the female prostate gland. Bartholin gland is homologous to the Cowper's gland of the males, right? And Graafian follicle, that is the mature ovarian follicle, right? Similar organs in males. So come to the labia majora, that is correlated with the scrotum. Clear? It is homologous similar organ in males, that is scrotum. Skene's gland, that is prostate gland. Bartholin's gland, that is the Cowper's gland. Graafian follicle, that is the seminiferous tubules, right? So the answer is 1B, 2C, 1B, 2C, 1 and A and D, and 3D, right? 3D. So the answer is D, 40D. Menopause is the stage in females when the reproductive capacity is arrested, that is the stoppage of the menstrual cycle. Complete stoppage of the menstrual cycle is known as the menopause, which occurs at the old age, that is 45 to 55 years of age. So the answer is C, right? How many ovas and sperm would be produced from 100 secondary oocytes and 100 secondary spermatocytes during the gametogenesis in the humans, right? When we know that one primary spermatocyte forms the 4 sperms and one primary oocyte form the 1 sperm, right? Oh, sorry, 1 ova. So secondary oocyte from 100 ovas and from 100 secondary spermatocyte, that is the 200 sperms are formed. Clear? So this is the answer. You can calculate it easily, right? Now come to the temperature of the scrotum, which is necessary for functioning of the testis, is always below than the normal body temperature, and that difference is the 2 to 2.5 degrees centigrade, right? Then the normal body temperature to conduct the spermatogenesis properly, right? Come to the next, that is 44. Fibrinolysin lysis, that is breakdown, right? It breaks the fibrin, that is it prevents the clotting of semen. So the answer is 1D. Prostaglandin neutralizes the acidic pH, that is 2A, right? Phosphorylcholine, that is the source of energy, and mucus and ions, that is the uterine contraction. So 1D, 2A, 1D, 2A. Answer is D. Come to the next, that is 44. Match the list, right? Fibrinolysin, as its name suggests, it lysis of the fibrin, right? That fibrinolysin preventing the clotting of semen, that is 1D, right? Prostaglandin is responsible for the causing of the labor pain, the uterine contraction, right? For the movement of the sperm in the female genital tract, right? So prostaglandin is the long chain of the unsaturated fatty acid which is present in the seminal vesicle secretion, right? So it is related with the uterine contraction, that is 2C. Phosphorylcholine is related with the source of energy, right? And the mucus and ions neutralizes the acidic pH. So answer is C, right? All these are cancelled. Now come to the last question, that is 45th. Arrange the following reproductive events sequentially in which they occurs in humans, right? First is the gametogenesis, right? So first one is the gametogenesis. Second is, after the gametogenesis, what will happen? Insemination, then fertilization, right? After that the implantation, then gestation, and then the parturition. So 4 5 3 1 4 5 3 1 4 5 3 1 2 6. Answer is D, right? Clear? So this is all about the human reproduction. Thank you.